5:30, the Channel 3 I-Team is investigating Connecticut's kids in crisis.
3 years after the start of the pandemic, parents say they still struggle right now to find enough resources to meet the mental health needs of their kids and teenagers, with many of their children ending up in emergency rooms.
Now, the state committed millions of dollars to addressing the issue, but is that commitment working? Chief Investigative Reporter Sam Smink takes a look.
If 5-year-old Keegan's life was a song, things haven't always felt in rhythm.
It started with him disrupting classrooms, had a hard time regulating his emotions, had very bad impulse control.
Keegan has oppositional defiant disorder and ADHD.
Basically, they do the opposite of what you say. They have a hard time accepting boundaries. Sit down.
For the last year, Sarah Arpin has been fighting to find help for her son.
Mental health services are very few and far between for him. A child his age, it's very difficult.
Their journey started with a call to 211, a free phone service that connects people to resources, followed by a trip to the Bacchus Hospital ER last June. There, Sarah says Keegan waited days to be transferred to a psychiatric program in Hartford because he wasn't 5 years old yet.
He was on a psychiatric hold for 3 days until his birthday.
During the family's next trip to Bacchus ER in December, Sarah says they waited 5 days before they could get Keegan inpatient care because there were no beds available.
It's really hard to find services. I mean, it's just, we need to do better.
It's still happening today. Kids waiting in emergency rooms, unable to access the care they need. According to the Connecticut Hospital Association, from January through April 27th of this year, on average, there were 26 children and teens in the ER who were waiting for an inpatient psychiatric bed, but there were only 8 open beds available. Across the entire state, there are 118 beds, around 1 bed for every 7,700 kids.
We know that we had an access to care problem beforehand, and it's all just been amplified over the last several years.
Dr. Melissa Santos is the head of pediatric psychology at Connecticut Children's in Hartford. She says children and families tend to end up in the ER asking for help because navigating the mental health system in the first place can be tricky.
Does anybody even know how to start?
During the peak of COVID, Connecticut Children saw upward of 50 kids in the ER almost every day.
We had kids in the emergency room, we had kids on our medical floors, but there was no throughput. The continuum of care was completely clogged.
The numbers these days are lower, a daily average of 15 to 26 ER patients at Connecticut Children's, but still more than what President and CEO Jim Schmerling would like.
We wouldn't need as many inpatient beds if we were doing better on the front end. Also on the back end, once a child's been admitted and we discharge them, they have to have a place to go to continue getting therapy on an outpatient basis. The whole system is broken, and in the meantime, these children and their families deserve much better than what we're giving them.
Last May, the state legislature set aside $300 million for children's behavioral health services. The I-Team requested state records. Adding up the numbers, we found more than $135 million was designated for specific programs. More than $95 million has been spent.
We are going to stay with this because these are our children.
State Senator Zahoud Anwar says the legislature is working on a solution for long-term funding.
Our challenge is that we are under some restriction because of the guardrails for our finances that we have put in.
As for Keegan, he's currently in play therapy, which Sarah says is helping. She's hoping it will keep their future in harmony. There is some hope. Coming up at 11 tonight, we will tell you about the 4 new urgent crisis centers coming to the state, as well as the new inpatient med psych unit at Connecticut Children's. For the I-Team, I'm Sam Smink.